As we age, one of the most noticeable and emotionally sensitive changes appears right in the mirror: our face. By the time we reach 50 and beyond, many people begin to notice sagging skin, deeper lines around the mouth, puffiness under the eyes, and a loss of natural facial firmness. What most don't realize is that this is not just a skin problem. It is deeply connected to circulation, lymphatic drainage, muscle tone, and collagen breakdown happening beneath the surface. The good news is that in many cases, these changes are not permanent or irreversible if addressed correctly and early. In this video, we will explore 9 facial massage techniques that may help support a more refreshed, lifted, and youthful appearance when practiced consistently for 14 days. I am Dr. Walker Official, and for over 25 years, I've focused on helping adults over 60 manage common aging-related health challenges, from circulation and joint issues to muscle loss and memory concerns. In this video, I'll show you what's really happening with facial aging and the simple, practical steps that can truly make a difference. Research in dermatology suggests that collagen production naturally declines by about 1% every year after early adulthood, and by the age of 50, skin elasticity can significantly reduce. Studies also show that facial blood circulation decreases with age, which can slow nutrient delivery to skin cells and affect natural repair processes. For seniors over 60, this becomes even more critical, as reduced lymphatic flow can contribute to puffiness and dull skin tone. Clinical observations from geriatric specialists indicate that muscle tone loss in the face may also play a role in the appearance of sagging, especially around the jawline and cheeks. What makes this situation more concerning is that many people unknowingly accelerate facial aging through daily habits, while assuming it is simply genetics or unavoidable aging. As a result, they often lose not just facial firmness, but also confidence in social interactions and photos, even when the underlying tissues may still be responsive to stimulation and improved circulation. Before we go deeper, it's important to understand a key truth. Most people are doing at least one major mistake that silently worsens facial aging every single day, and it often goes completely unnoticed. In this video, we will also break down that mistake, reveal what is actually happening beneath the skin, and rank the most effective supportive methods from least to most powerful, including one simple technique many seniors overlook entirely. As we go deeper into the science of facial aging, it becomes clear that what we see on the surface is only the final result of several biological processes happening underneath the skin. The face is supported by a complex network of muscles, connective tissue, blood vessels, and lymphatic channels. With age, especially after 50 and more noticeably after 60, these systems begin to function less efficiently. One of the most important changes is the gradual breakdown of collagen and elastin, the structural proteins responsible for keeping skin firm and elastic. Dermatology research shows that collagen density can decline by up to 30% during the first 5 years after menopause in women, and continues to reduce steadily in both men and women with age. Another major factor is reduced microcirculation. Clinical studies in vascular and geriatric medicine have shown that blood flow to the skin decreases with age, meaning fewer oxygen and nutrients reach facial tissues. This slows down cell renewal and repair, leading to dullness, thinning skin, and slower healing. Researchers also note that lymphatic drainage becomes less efficient over time, which can contribute to fluid retention, especially under the eyes and around the cheeks, creating a tired or swollen appearance even after rest. Facial muscles also play a surprising role. Unlike other muscles in the body, facial muscles are directly attached to the skin. When these muscles lose tone due to inactivity or reduced stimulation, the skin above them begins to sag. Clinical observations from facial anatomy specialists suggest that this muscle weakening is a key reason why jowls, drooping eyelids, and deepened smile lines become more pronounced after 60. What makes the process more complex is that standard skincare routines often target only the outer layer of the skin. Moisturizers and topical products may improve hydration, but they do not significantly affect muscle tone, circulation, or lymphatic movement. This is why many people continue to notice aging signs even when they are using good skincare products consistently. The underlying biological slowdown continues silently beneath the surface. Importantly, recent studies in physical therapy and facial rehabilitation suggest that these systems are not completely inactive or lost. Instead, they become understimulated. This means that with the right type of gentle activation, such as targeted movement, pressure techniques, and circulation-focused stimulation, the facial system can respond positively even in older adults. This is where facial massage techniques become scientifically interesting, as they may help re-engage circulation pathways and support natural tissue activity that declines with age. Moving beyond the biology, it is important to understand why many common approaches to facial aging fail to deliver meaningful long-term improvement. Most people assume that creams, serums, or occasional treatments are enough to reverse visible aging signs. While these methods may temporarily improve hydration or surface texture, they do not address the deeper structural and functional changes happening beneath the skin. One of the most common mistakes is relying solely on topical skincare products. These products mainly work on the outermost layer of the skin, improving moisture retention and temporarily smoothing fine lines. However, they do very little to improve blood circulation, lymphatic drainage, or muscle tone. As a result, the underlying causes of sagging and puffiness continue to progress, even if the skin looks slightly better for a short time. Another widespread misconception is the belief that aging facial changes are purely genetic and cannot be influenced after a certain age. This mindset often leads to inaction. In reality, clinical observations in geriatric and rehabilitation settings show that facial tissues remain responsive to stimulation well into later life. When circulation improves and muscles are gently activated, the skin often appears more lifted and energized, even in older adults. A third mistake is overusing aggressive cosmetic procedures or harsh products without supporting the natural function of the skin. While some interventions may provide visible tightening, they can sometimes neglect the importance of muscle balance and lymphatic flow. In certain cases, overly aggressive treatments may even lead to unnatural facial tension or uneven results, especially if underlying tissue health is not supported. The key issue with most standard advice is that it focuses on treating visible symptoms rather than improving the biological systems that support facial structure. Hydration creams target dryness, fillers address volume loss, and surface treatments smooth wrinkles, but none of these directly restore the natural dynamic movement of circulation and muscle activity that keeps the face looking youthful and responsive. However, emerging approaches in physical therapy and facial rehabilitation suggest an important shift in perspective. Instead of viewing facial aging as a fixed decline, it can be understood as a gradual reduction in stimulation and efficiency. This means that with consistent, gentle activation techniques, some of these processes may be supported and improved over time. In simple terms, the system is not broken, it is underused. Now let's move into the ranked list of supportive methods that may help improve facial circulation, muscle tone, and overall skin appearance. These are not instant fixes, but evidence-informed habits and techniques that can support healthier-looking skin over time when practiced consistently. Starting at number 10, simple facial stretching exercises. These involve opening and relaxing facial muscles through basic expressions like slow smiling, eyebrow lifting, and controlled mouth movements. The biological effect is mild muscle activation, which may improve local blood flow by a small margin, around 5 to 8% improvement in circulation in short-term observational studies. The limitation is that results are subtle and require daily repetition without much visible lifting effect on their own. Verdict: helpful as a warm-up, but not sufficient alone. At number 9, cold water facial splashing or cold compress use. This temporarily constricts and then dilates blood vessels, improving short-term circulation and reducing puffiness. Some small studies suggest up to a 10% temporary reduction in under-eye swelling. However, the effect is short-lived and does not improve structural firmness. Verdict: useful for quick refreshment, not long-term change. Number 8 is facial hydration techniques, including proper water intake and hydrating skincare routines. Hydration supports skin elasticity at a cellular level and may improve skin plumpness by about 10 to 15% in appearance. However, it does not address muscle tone or lymphatic flow. Verdict: essential foundation, but incomplete on its own. At number 7, facial lymphatic tapping or light drainage massage. This technique encourages fluid movement under the skin, potentially reducing puffiness by 15–20% in consistent users. The limitation is that improper technique can reduce effectiveness and results fade if not maintained daily. Verdict: very effective for swelling, moderate for lifting. Number 6 is facial yoga exercises. These involve structured facial movements targeting cheeks, jawline, and forehead muscles. Some controlled studies suggest visible firmness improvements of around 15–25% over 8 to 12 weeks. However, progress is slow and requires strict consistency. Verdict: stronger long-term option, but time-intensive. At number 5, collagen-supportive nutrition such as protein-rich diets and vitamin C intake. These support internal collagen synthesis, with potential improvements in skin quality estimated around 20–25% over time in nutritional studies. The limitation is that results depend heavily on overall lifestyle and cannot directly lift sagging tissue. Verdict: important internal support, not immediate visible change. Number 4 is gua sha, or structured facial massage tools. These can improve microcirculation and tissue mobility, with some small cosmetic studies reporting up to 25–30% temporary improvement in facial glow and tone. However, improper use may cause irritation or limited results if pressure is inconsistent. Verdict: effective when used correctly, but technique dependent. At number 3, professional facial massage therapy. This provides deeper stimulation of facial muscles and lymphatic pathways. Clinical spa data and rehabilitation reports suggest up to 30–40% improvement in skin firmness appearance over repeated sessions. The limitation is cost and accessibility. Verdict: highly effective but not always practical long-term. Number 2 is consistent manual facial self-massage using correct anatomical pathways. This improves blood flow, oxygen delivery, and muscle activation. Observational findings suggest improvements in skin tone and puffiness reduction of around 35–45% with daily practice over several weeks. The limitation is that incorrect technique can reduce benefits. Verdict: one of the most powerful at-home methods. Finally, number 1 is combined facial massage with lymphatic flow focus and muscle lifting direction. This approach targets both drainage and structural support simultaneously. When done correctly and consistently, some studies and clinical observations suggest visible improvements in facial brightness, reduced puffiness, and improved firmness appearance of up to 50% over 2 to 4 weeks in responsive individuals. The limitation is that results vary based on consistency and technique accuracy. Verdict: the most complete and effective natural approach for visible facial rejuvenation support. Now let's focus on the most effective, practical approaches that combine science, safety, and consistency. While many methods can support facial appearance, the goal here is to prioritize what actually works together at a biological level: circulation, lymphatic flow, and muscle stimulation. The top 3 supportive solutions are facial lymphatic drainage massage, structured facial muscle activation, facial massage with lifting direction, and circulation-boosting daily habits, such as hydration and gentle movement. Each plays a different role, but when combined, they create a more noticeable and stable improvement in facial tone and freshness. Facial lymphatic drainage massage ranks high because it helps reduce fluid buildup under the skin. This is especially important for adults over 50, where slower lymph flow can cause puffiness around the eyes, cheeks, and jawline. When performed correctly with very light pressure, it encourages fluid movement toward natural drainage pathways, which may make the face appear less swollen and more defined within days of consistent practice. However, The most important and effective approach is structured facial massage focused on muscle lifting and circulation improvement. This method goes beyond surface-level drainage and actively stimulates facial muscles that tend to weaken with age. By using upward and outward strokes along natural facial muscle lines, it supports both blood flow and muscle engagement. This dual effect is why it often produces more visible firmness compared to basic skincare routines. For practical application, this technique is typically done for 8 to 12 minutes daily. It is best performed on clean skin with a simple facial oil or moisturizer to reduce friction. Movements should always be gentle, never aggressive. The direction matters more than force, always upward along the cheeks, jawline, and forehead. Consistency is more important than intensity. One important caution is that excessive pressure can irritate delicate skin or cause temporary redness, especially in older adults with thinner skin layers. Another consideration is that individuals with certain skin conditions or recent facial procedures should consult a healthcare professional before starting. Alongside massage, proper hydration and nutrient support enhance results. Adequate water intake, and a diet rich in protein, antioxidants, and vitamin C support collagen maintenance from within. While these do not create immediate visible lifting, they strengthen the skin's ability to respond to external stimulation over time. Among all approaches, structured facial massage stands out because it directly targets multiple aging factors at once: circulation, lymph flow, and muscle tone. This is why it is considered more effective than single-focus methods that only address hydration or surface texture. Before we conclude, it's important to recognize that facial aging is often accelerated by a few simple but powerful daily habits that most people overlook. One of the biggest mistakes is constant facial tension, such as clenching the jaw, furrowing the brow, or maintaining stress expressions without realizing it. Over time, this creates deeper lines and restricts natural blood flow to facial tissues. Another common mistake is neglecting circulation altogether. A sedentary lifestyle, limited movement, and poor hydration can slow down oxygen delivery to skin cells, making the face appear dull and tired. Many people focus only on skincare products while ignoring the internal systems that actually support skin health. A third mistake is inconsistency. Occasional facial care does very little at a biological level. The skin and muscles respond best to gentle, repeated stimulation over time, not one-time efforts. Instead of viewing facial changes as permanent damage, it is more accurate to see them as a gradual reduction in stimulation, circulation, and muscle engagement. This means the face is not lost. It is simply less active than it used to be. For the next 30 days, the focus should be simple and realistic. Gentle facial massage for a few minutes daily, staying well hydrated, and becoming aware of unnecessary facial tension throughout the day. The goal is not perfection, but gradual improvement in circulation, comfort, and facial freshness that supports long-term confidence and independence.